and 15 minutes past the top of the hour. Welcome back. This is Morning Cafe. I'm yours truly, standing at Ringita from the whole ties and suiting up right now. We are dressed in whole sport shoes and everything, just to prepare for some fitness. Ali, we told you that that particular hole, you misbehaved. Ni kweli na ni vizuri kukubali that, you know, eating a whole mbuzi during the whole December holidays. And we'll be getting into fitness later on with a fitness trainer this morning, Simba. But then before that, we'll be talking about matters nutrition and the whole bit of how you should really be doing and minding your nutrition, even in the kitchen. But then now, even on a larger scale, the whole nutritional policies and the effectiveness of them. And even as we continue, let me run some numbers with you. So back in 2023, 942,000 children aged under 5 and 135,000 pregnant women and breastfeeding mothers were acutely malnourished. And we'll be getting to know why is this and why this particular number we are having it. And to help us have this conversation, the first guest of this particular segment for 2024, Edgar Okoth Onyango, the National Coordinator and Head of Secretariat at Scaling Up Nutrition and Civil Society Alliance Kenya. Karibu sana.
Thank you so much, Stanley.
Happy New Year.
Happy New Year to you too.
I hope your year has started well.
Yes, and this is just a highlight of how my year started, having opportunity to talk to citizens, but also opportunity to be able to do some education on how we've been doing and how we need to do in terms of kickstarting the new year.
Oh, yes. And even before we actually get into the new year, let's go back to, last year, the whole gearing up to the festivities, and largely the biggest thing that really brings people together ni chakula. Kuna kitu ingine, well, kuna ile mambo ingine kando ya vinywaji and all that, but basically, it's food and drinks. So you can really start by telling us, what is nutrition, first of all?
Nutrition in a broader definition is, or in a simpler definition, is just how you utilize the nutrients, how the body takes in the nutrients, assimilate the nutrients, and then utilize them to build you. Yeah, and that's why we say you are what you eat. Yeah, so just in a simple definition, just how your body utilizes the nutrients that you take in.
Right.
Simple like that.
So now, even before the festivities, naturally, as Kenyans, as human beings, do you think we have that discipline and being mindful of, how nutritious our food should really be, or you just, cook just into tushibe too?
I think it's something that we really need to classify, because not everyone is conscious of what they eat. And it's largely because of the economic difficulty. I mean, sometimes people just want to fill their tummies. I mean, they just want to feel full and that's it. However, you find a segment of a population that are really conscious of what they eat. Because when they go to the markets, you see them select the locally available, the traditional food. I mean, they try to balance some of these food that are rich in different nutrients. So it's looking at it on a broader, but also in terms of being able to classify the population. So I don't want to say that people are not conscious of what they eat. I think it's we've really done some good work in terms of educating the population to be able to understand what really they need to be able to take in. So we are seeing that information really percolating to the population, and people are really starting to be conscious of what they eat. And that's why even if you go to communities, then you ask them, okay, fine, so then what do you eat on a typical day? Then they'll start to tell you, and then you realize that, yes, they're really becoming conscious of what they eat. However, in Kenya, we have a tradition of forgetfulness.
Oh, yes.
So you practice it for a while, and then you forget, and then you just overindulge on whatever you find.
Right.
Yes.
We'll get into matters the whole of indulging later, because it really brings up the whole matters, the cost of it.
Yeah.
But then you talk about population, and I'm curious, when you talk about population, 70 or even 80% of our population in Kenya are the youth, about 70 something percent.
Yeah.
And when you talk about the youth, 18 to 35, mostly the people who, the populace that really, are very serious when it comes to matters of nutrition, what is eaten in the morning, lunchtime, even, supper, are people who are older than 35, our parents and all that, 50s and way past 40s, probably because of the kind of lifestyle diseases they might try to prevent. In your experience, do you think right now the youth are really trying to, add into the whole nutrition kind of and make sure that they actually follow this?
No, not really, because, a larger proportion of the youth live in the urban centers.
Yeah.
And because of the urbanization, every 2 blocks you walk, you'll find a convenience store. Maybe they have chips, they have these fast foods all over the place. And they tend, the youth like things that are really going very fast.
Oh, yes.
So they tend to eat a lot of fast food. And that's why quite a number of studies show that some of these lifestyle complications that were meant for the older population are now affecting the younger population, just because they are not very conscious of what they eat, and then they really practice some very bad nutrition practices whereby they want to starve themselves for some time, and then they also go and then eat this fast food. So that also affects them quite a lot. Not that they're really conscious of observing nutritive food, not that they're really conscious of looking at how then do you even exercise, because then it's not just about eating, it's about also how then you also exercise. So the youth are really contributing to some very bad nutrition outcomes that we see, and it's really worrying us, because again, these are the people who are really at their productive stages. And if you have very bad nutrition outcomes as an adolescent, also as a youth, then that also leads to the next generation. Then the child that you bear then again also starts having these complications early in life. You find that they start having diabetes very early in life, type 1 diabetes very early in life. And that also, when also they start going to primary school, then diabetes type 2 starts creeping in because of you are obese, you're overweight and all that. So the youth are not really observing the nutritive rules that we have. But then we find that as they now grow into adulthood, then now they start being very conscious in terms of what they eat, and then now they reduce a lot of this junk food, the processed food, simply because they have started suffering some of these lifestyle complications, but also now they have started getting information on then how then do you reverse some of these lifestyle complications. So then as you grow into the adulthood, then you find them, they're now starting to practice a lot of good nutrition habits.
But Edgar, is cost an excuse in all this, making sure that you actually have a balanced diet? Because when you talk about nutrition, a balanced diet really has to be there. So you talk about the balanced diet for the breakfast, and you ensure that you have, carbohydrates, proteins, all these particular nutrients in there for breakfast, lunch, and supper for 7 days a week. Can cost, for a young person watching us, they're 22 years old, probably unemployed. They're like, as much as I'm really willing to, but I'm not able to afford all that. Can that be an excuse?
That's a very tricky question, because I've been there before, whereby you don't have a job, you don't have any source of income, but you have to eat. So then you caught between what do I do and how do I even eat, whereby I can't afford it. So I wouldn't want to say that it really should be a very big excuse, but it is a limiting factor. And this now brings us now to the conversation of the broader food systems in terms of how then do we make this food affordable at all the time, accessible to all the people. So that now leads to a much more bigger stakeholder engagement, to be able to ensure that this food is affordable everywhere where you need it. So to some extent, yes, I think cost is a limiting factor to access to nutritive food, because we do not produce enough. We are a net importer of food. And especially those who live in the urban centers, all our food comes from outside. So then that again also drives in the cost element. And there have been a lot of conversations in terms of how then do we drive down this cost of food. So I think it's a conversation that we need to have in terms of is cost of food an excuse? I wouldn't say that it's an excuse, but it is a limiting factor, yes, to consumption of nutritious food.
But then, okay, fine. I mean, you were talking about an urban setting, but then now let's go to the rural.
Yes.
And you'd find probably somewhere in Western, a child is malnourished. Not that there's no food there, but then, I mean, probably this, where this child lives, there is a lot of, probably it's just bins. And this child is, fed with one particular type of food for a number of days. Talk about that also, because you'd find in Kenya, you'd probably find maize is largely grown in certain areas, probably if it's coffee or tea in certain areas and all that, probably if it's kama ndizi pale mimi natoka, one area. So for a child, amezoeshwa that particular type of food. How does that really impact?
Now, what you're saying is really true, because if you look at the statistics that we have, is that some of these areas where you would otherwise say that they really have a lot of food, they have a variety of food, that's where we find high malnutrition cases. And this boils down to two factors. One is childcare practices among our parents, but also in terms of information, and also the question of what is food. And many of the residents of these areas, they produce, they have chicken produces eggs, they have cows that produce milk, they have gardens that they produce a variety of food and a variety of fruits. But the sad story is that they will sell off this produce, and then they'll want to buy bread, they want to buy chapati, mandazi, and milk to be able to, the overprocessed milk to be able to give to the kids. So it's about information that they need to have in terms of they need to produce to consume, and then the excess is what they can sell to be able to have to have some money to meet some other economic issues that they have. And some conversations that we've had with them is that I need to have money. So, and that's the excuse. I need to sell off these things so that I can have some money in my pocket. And some of them want to have money to travel to the urban centers to go and see what's happening in the urban centers and then buy some bread and come back home with. So we're doing quite a lot with the communities and just educating them or re-educating them in terms of what is food that has got high nutritive value. If at all you are cultivating potatoes, the sweet potatoes, then you need to consume these sweet potatoes, not just on a daily basis. If you have, if you're growing green bananas, then you also need to consume these green bananas. Then
so basically, and sorry to cut you short, so basically this again means that you're educating the farmer that don't just plant as long as it grows, plant that you grow something that you know the nutritional benefit of it. So it's about having diversity in the diet. Right. And the more colorful your plate is, the better it is for you. And some of this traditional food, people are running away from them. I think it's because of the modernity. We want to feel that we are modern, I want to feel that when you come to my home, then you don't see Mrenda around. You don't see that I'm consuming. Yes. You want to see that, okay, fine. We have eggs, we have sausages, we have all these. And we're telling them that, these are things that have been brought from elsewhere. Yes, they do not form part of our food systems. We call them, they don't form part of our food systems. We have our traditional food systems that we really need to embrace.
And these were very high nutritive value foods that we are consuming. But the irony is, you don't want them to be consumed at home back in the village. But then when you come to the urban centers, they are very expensive.
Oh, yes.
Yeah, a plate will cost you around 300 shillings. While at home, it will cost you 0 because you can walk around. Some of them are like weeds.
Yeah.
You walk around and you can pluck and be able to consume. So that's the irony that we are seeing. In the urban centers, we're really walking around to find them. While in the rural centers, people want to consume the sausages, the highly processed foods, which are really not really good for our health. Mm-hmm. Yes, I think, and now we're seeing it as much as now there's been a lot of migration. People are now moving. The counties have now brought this closer enough to, closer enough to the villages.
Yeah.
And then now people are now starting to realize that the real food is actually the food that you have in the village, because then the kales that you consume in the village are totally different from what you consume in the urban city.
Yes.
The taste is totally different. Yes. Even the cooking time is totally different.
Yes.
Even when you look at the tomatoes that are here in Nairobi versus the tomatoes that are there back in the village, they're totally different in terms of even the taste and even how nutritive they are. So we're always encouraging people that these traditional foods are the foods that people need actually to consume.
Because, and on that note, we were talking about how the more the colorful the plate, the better for it. But then there's always one color on that plate that is always synonymous, mostly the color white, or brown, depending on how you cook your ugali. And this is a conversation we've always been having as a country, the over-reliance of ugali as a staple food, and maize, basically. Why, from where you sit, why have we not really tackled that and stopped being over-reliant on ugali and maize? Is it that there are no other, options? Is it that we're not ready to actually tackle some of these other options?
Yeah, it's a really good question, because there's a time I was meeting with members of parliament and they posted a question to me that, what is food? Because anytime we have insufficient maize in the country, then everyone cries we don't have food, including those who do not consume, even including the northern areas. They'll say we don't have enough food. So I think it's because we've run away from what we used to cultivate before, because we used to cultivate a lot of cassava. We used to cultivate a lot of sorghum and finger millet. We used to cultivate a lot of sweet potatoes. So yes, we have alternatives. It's just that maize has been commercialized. And then people always know that when I have a bag of maize, then I can sell that. And even schools, you can pay school fee using bags of maize, but can you pay school fee using bags of cassava? So I think it's a conversation that already we are having in terms of how then do we broaden what we'll call our staples. Because then readily, in Kenya you can grow a lot of cassava that can replace maize. Already rice is being grown a lot, and we're seeing a lot of consumption of rice. Where I come from, if you consume rice, you say... No,
mostly at night, where you've not eaten, yes.
Yeah, I haven't eaten, so I'm waiting to be able to. If you eat githeri, then you say, okay, fine, no, that was just a snack, I need to eat. So I think it's a conversation that people really need to be, not even convinced enough. I think they just need to understand that maize is not the only staple that Kenya can produce, and we don't even produce enough of it. I think we import quite a lot. So it's us as the elite to lead the way. The media also need to talk about this over and over again and showcase where people are replacing a lot of maize farming to the other alternatives that we have, the traditional, which are more nutritive that we have. So it's something that we're seeing pole people are starting to embrace it. The brown ugali. You go to any restaurant right now and ask them for brown ugali. it's more expensive. Yeah.
Yeah, but you had mentioned matters importing, and I'm curious, when you take a look at Kenya, from where you sit and your experience so far, we really borrow a lot, and we envy countries like Uganda, talk about how much food they really have, and other African countries. What can Kenya really borrow from, let's say, Uganda?
I mean, you go to Uganda, I mean, and ask for breakfast. You'll think you're eating lunch or you're eating dinner. I mean, it's all a variety of food that will be served, and it's more of their traditional food that they consume, and let me not blame urbanization per se for this, because with urbanization, we are actually borrowing a lot of food from the Western world, thinking that that's the way to go, so that if someone tells you, can I serve you English breakfast? So you think, okay, mimi nimefika, I'm eating English breakfast. Yeah, so it's what is it that we can borrow? I think let's get back to our roots, and let us embrace the consumption of boiled green bananas. I mean, it's really delicious, boiled green bananas, it's really delicious. Let's eat pumpkin, Yeah, some people you serve them. I mean, kids of nowadays, I mean, you serve them pumpkin, they look at you and think, okay, fine, so what is it that you're going to serve us? Yeah. So it's about us embracing our food. Kenya, we have our traditional food.
Yeah.
Let us embrace that. And again, let us look at what we eat. Before, when you sat down to eat breakfast, it is the heaviest meal of the day.
Yes. I mean, they definitely say you eat like a king.
Yes.
That's breakfast.
Yes.
Lunch, you eat like a poor man, and then the supper, you eat like a queen.
At a pauper.
Yes.
Yeah, so I think it's about us embracing that and practicing it, because again, there's this element of knowing what to do, but also practicing it. What to do. I mean, we have been accustomed to taking coffee or tea with 2 slices of bread and maybe bacon or sausage, and then that's it. Instead of us sitting down to eat well in the morning. Yeah, so when we can change this, and we call it a total lifestyle change.
But then, I mean, you mentioned that you met with a couple of MPs, and I'm curious, because the MPs, at the end of the day, they implement, rather they make some of these policies, and at the end of the day, some of these policies come to hurt and pinch Kenyans in one way or another, maybe even the whole price, the fluctuations of it, and so on and so on. So far, how have we come when it comes to policies regarding nutrition? It
brings us to the whole conversation around what is a policy? Yeah, because again, we need to understand what a policy is. Yeah, because policies are just guidelines that government uses in terms of making decisions on what to do and what not to do, and also what really needs to be prioritized. And again, how do we make the policies? Because some quarters feel that policies are left for certain people to make, while really there are also a certain segment of people who need to implement policies. So government needs to make policies and implement them without having to involve the community. While the reverse should be true, the policies really need to address the problem. Yeah, so if you come up with policies that do not address the problem, then that means that the policy will not be fully implemented. Some policies just address perceived problems and not really the felt needs at the community level. And policies really need to be driven from the community perspective, because that's the end user. That's the person who gets affected much more. Yes,
and so how much of a role now does the community really have? In other words, do their voices really count? Because the MPs will tell you, well, we did, we talked to this community and this is what they said, and all that. But do their voices really count when it comes to, at the end of the day, penning some of those policies?
In theory, the voices really count, because then we have the public participation engagement that we really need to have. But then from where I am, I think from the experience that I've had is that we need to start involving the community members right from when we are making this agenda setting, because before you make a policy, then you need to really identify what the problem is about. And is this problem, does it warrant a policy decision? Because sometimes we have a very small problem, then we throw a policy into it. Yeah, while this problem can actually be addressed administratively. So in theory, yes, the voices really count. And we've seen examples of policies whereby communities have made a lot of noise and people have retracted in terms of government policies, so that they are relooked at in terms of how then can it address this specific problem. So when we're making these policies, then from the start, from the word go, then you need to involve the community voices. You need to ensure that the representatives are really involved. You really need to ensure that the policy that you're making is addressing the problem that is affecting a broader nation. Not just very specific issues that you can be able to address using a policy.
And speak of which, the Kenya Nutrition Action Plan for 2018 to 2022, talk to us about it. Because, believe it's, from 2018 to 2022. So after that, did we have a whole other action, nutrition action plan? Was the previous one effective to that bit?
Now, when you talk about the Kenya Nutrition Action Plan, this is a multi-sector document that highlights interventions that really need to be put in place to address nutrition issues. And these interventions are actually classified into three. So we have nutrition-specific interventions that really tackles nutrition issues directly. Then we have nutrition-sensitive interventions that other line ministries need to implement to be able to tackle malnutrition issues. Then we have the enabling environment. So we have these three categories have also now been addressed to what we call the key result areas. And we have 19 key result areas within the Kenya Nutrition Action Plan. These have been costed and were given timelines in terms of how they are supposed to be implemented. So all these 19 key result areas address specific nutrition or malnutrition issues within the communities. So they have been implemented for 5 years. And currently we've done an evaluation of that document, and now we are making the third generation. We had the first generation, then the second generation, 2018 to 2022. We are now in the process of coming up with the third generation that will now take us to 2027 in terms of implementing nutrition interventions here in the country. Now, we've not stopped at that point. So that was at the national level. At the county level, they have also developed county-specific nutrition action plans that address specific issues within those particular counties, because remember, counties are also different in their own priorities. So they have also prioritized their own interventions at that particular county that are also addressing specific issues within those specific counties. Yes.
So even as we wrap up, Edgar, we had the whole El Nino, and the Met Department says it will definitely continue. So this is going to have a huge toll on even the nutrition in the country. What do you foresee for even as you give us your last words?
Yeah, so I think the El Nino has really affected the nutrition issues here in the country, because even for those who had bumper harvests, those harvests have been swept away. Those who had farms, the farms have been swept away. So for me, really, is we're going to see a lot of malnutrition issues as we move forward. Remember, after the El Nino, then we're going to have the dry spell. So, and I think that has been the cyclic thing in the country, whereby you have too much rain, then there's no rain. So both ways affect the nutrition issues in the country. And we're seeing that is going to affect these. And I know in the next survey that is going to be done, then you're going, as much as, yes, we've made really tremendous improvements in the malnutrition issue, in the stunting, wasting, but also in obesity. But then we're going to see those are going to be eroded because of the El Nino rains that we've been facing in the country.
Right.
Yes.
Asante sana Edgar, Okoth Onyango, National Coordinator and Head of Secretariat at Scaling Up Nutrition Civil Society Alliance Kenya. Asante sana for your wise words, quite definitely. It is 8:45 a.m. You're probably having a breakfast right now. Some takeaway from what Edgar is telling you. Have it heavy. Have it heavy so that, you know, tafuta some sweet potatoes there, tafuta some boiled mahindi pale, tafuta wachana na mkate, you know, all that, so that ukuwe na mwili kama hii, so that ndio hata pia mimi nikifanya hivi. But niaje Simba?
Poa sana.
Ko fresh?
Ko fresh.
Ni kama ndio ini mahindi ama ni
sweet potatoes, rice. Basically everything amekuwa anasema, that's what we do in bodybuilding and fitness. You have to have the clean diet, you have to train right to get the physique you want.
How many times a day ndio unajaza tumbo?
For me, I eat 5 meals a day.
5 meals a day?
Yeah, not necessarily all heavy, but as you said, the first parts of the day, the carbs are high because you need energy and the active starch to fuel your workout to sustain you during the day. And then hizo zingine you prioritize your veggies and proteins as you go.
Right.
Yeah.
Right. Karibu sana Simba.
Thank you so much for having me.
This particular day, inviting you here so that December we have misbehaved. Tumekubali hiyo because, you know, eating a lot of fat and unnecessary things because you're like, in December, ni Chrissy and all that. So to celebrate, you know, Jesus and all that. So this particular day and starting our January strongly. Basically, what will, you know, before we had a short break, so after the break, what will we be doing?
Well, I can take us through a simple full body circuit so that you understand how to get your blood flowing throughout the body and burn that extra fat.
All right.
Yeah, so when you go on an extra fat diet or extra sugar diet, the first place that the body stores